So the floating technique is what we're talking about, which is kind of different in a way because you're going with it. Well, here's the analogy I would use with kids, because I wouldn't say, hey, kids, do you remember when you were at the childbirth preparation class? I mean, you were there, you just don't remember, right? No, I would say something like, how come trees in Pennsylvania don't break when the wind blows? How come trees in Pennsylvania don't break when the wind blows? Anybody? Raise your hand. They bend. They're flexible. Next time you have this kind of anxiety, let it blow through you like wind through the trees. Don't stiffen up. And then fourth step is let it pass. So you're encouraging your clients to let it sort of move through without resisting it and breathing through it. So that's the idea. That's why the analogy to the childbirth preparation class makes some sense to me, that you're training yourself to be able to let it move through you rather than tense up and hold on to it. Now, a lot of clients will tell you that they feel they're experiencing panic attacks like waves, and one adolescent girl once said to me, I had a panic attack I had a 2-week panic attack. And I said, well, if you had a panic attack that lasted 2 weeks, you wouldn't have been able to eat or sleep. Probably what you experienced was many waves, many anxiety experiences. They came, they went, but they came again, and it was like 15, 20 times a day. And she said that's exactly what it was like. It felt like one big panic attack, but it was just a series of waves, and they came, they went, but they came again. Now, you can guarantee to your clients, even though psychologists like myself are not supposed to guarantee anything, and you probably all of your professions, you don't guarantee any results to your clients. You can say that you're pretty sure the next time they have a panic attack, it will pass. You can't tell them how long it'll take, but it's usually minutes. It will pass. We're assuming that we've got the right diagnosis, of course. And that could be reassuring, to know that it will pass, and that, but the purpose of this technique is A, know what you have, not be afraid of it. 2, have a skill that you're practicing that enables you to handle it when it happens. And when you have some success with that, when you have some positive experiences, the probability of panic anxiety goes down because you're not primed. You know, we use the term anticipatory anxiety in relation to panic disorder. We're anticipating when to have anxiety. Well, if you have a technique that you've been practicing, and it might not work every time, because if you remember when we talked about perfectionism, it doesn't work at a high level right away. You have to practice it, and sometimes it will work and sometimes it won't. But the idea is to have the confidence that you can handle it. When you have the confidence that you can handle it, the chances of it happening go way down. I would even go so far as to say you want to get to the point where you could say, so what? If I have this kind of anxiety experience, I know I'm not dying, I'm not having a heart attack, I'm not going crazy. I know what I can do. I've used it. It's worked. It may not work every time, but I know that it will pass. That's the key to the floating technique. So that's